afternoon. I'm Dr. Arvind, the chairman of the organizing committee of Pre-TM 2025 conference, and today is the last day. We have with us today Dr. Vishwanathan Mohan. He is the chairman and chief of diabetology, Dr. Mohan's Diabetes Specialty Center, Chennai, and he was our keynote speaker for the day. Sir, congratulations on a wonderful talk. And you spoke of neonatal diabetes. You spoke of new gene discoveries and how you are so happy that you could save a person from taking insulin and switch them. Can you summarize your talk for our viewers, sir?
Normally, thank you, Dr. Arvind, and thank you for having me at this conference. Congratulations, beautifully organized and very privileged to have given the keynote address. Normally, when you talk about diabetes, everybody knows about type 2 diabetes and about type 1 diabetes. But there are rarer forms of diabetes. We call them as atypical diabetes, and one of them is called as monogenic diabetes. Why we call it as monogenic is because there's a single gene mutation. That gene gets mutated, it produces diabetes. So we can say that that's the cause of the diabetes. Among that, there are different types. One type occurs in adults and it's called as maturity onset diabetes of the young, or MODY. And why we should know about MODY is because quite often it's mistaken to be type 1 diabetes and people treat them with insulin. And if you find out this genetic mutation, you can treat them with sulfonylureas. But the real poster child of monogenic diabetes is even more dramatic, a condition called as neonatal diabetes. This occurs before 6 months of age, that means in newborn children. And these children are almost always treated as type 1 diabetes and asked to take 3-4 times of insulin per day, which they don't need because they have certain mutations. Then they can stop the insulin and be treated with tablets. In fact, the tablet will work much better for them. So there are many other genetic syndromes and so on, but at least these two, the common forms, MODY type diabetes, in which there are different subtypes. And some of those subtypes, for example, MODY 2, if you find out GCK MODY, you can stop all treatment. They can be treated just with diet. They don't need any medicines. Whereas MODY 1 and MODY 3, they respond to tablets. They don't need insulin. Neonatal diabetes, there are many forms. 50% of them respond to tablets. So for that particular child or for that particular adult, it's a life-saving, game-changing thing, and they save a lot of money apart from so many pokes that they have to have every day.
Sir, many people, many clinicians in India ask one question. Dr. Mohan has the facilities, we don't have the facilities. How can we send the samples to Dr. Mohan Place? Sir, is there any other center doing a similar study, or is yours the only center?
We are the main center. CMC Vellore is also doing. There are a number of commercial organizations which are also doing. But the commercial organizations, I doubt, will do it free of cost. We are doing it free of cost. I'm not sure if anyone else is doing it free of cost. As a seva, we are doing this. And then the other thing is that since we've got the clinical expertise, we will only do it where it's needed, number one. And number two, we give the interpretation. And if there is any treatment suggestion to be given, we give all that. Whereas when a commercial organization does it, I've seen them sometimes give wrong reports. Sometimes they may not be true mutations, but something which masquerades as a mutation and so on. So I'm not saying that we are the only one who do it, but we bring with it the passion of being a clinician and also treating those patients. So the cost is not a factor. Like anybody in India can send the blood samples to us. Anywhere in the world, I think less than 2 to 3 weeks, I don't think it is possible today, even with the latest technology, to get the results. We are able to give it in the same time. And all we need is one blood sample. It is there on our website. It is there. All you need is an email to me, and my team will contact them, get the blood samples. Today, we're getting from all the medical colleges all over the country. They've got confidence now that they can send it and get the results. So we can do that, but if there are other places where you are doing it, it's not necessary to send it to England and all. Earlier, all the blood samples used to go to Exeter, and they were doing it also free. But then sending it to UK itself is very costly to send that. And then we are doing the same thing. We have been trained by them, and they've set up the lab in India for us. So it's not necessary to send the blood samples abroad. And abroad, if you're sending it to pay, it is very expensive. It can cost 1 lakh of rupees for one test, which actually costs only 2,000-3,000 rupees. And we are able to do that even without any charge.
Thank you very much for that information, sir.